So for our concept map, we chose the topic anxiety disorders. The etiology for anxiety disorder is that anxiety may develop from a variety of risk factors, including genetics, brain chemistry, personality, and life events. We've added the National Institute for Mental Health website just to show that they give a brief overview of it, the signs and symptoms of the different anxiety disorders, as well as the treatment modalities and the DSM-5 criteria. So basic signs and symptoms that affect the body in a person with anxiety are headaches, dizziness, sleep problems, nightmares, pulling of hair, inside cheek biting, nail biting, and red chapped lips, difficult swallowing, dry mouth and constant coughing, difficult breathing, chest pain, heart palpitations, nausea, vomiting, diarrhea, constipation, and cramping. Risk factors for anxiety disorders include definitely nursing school, trauma, drugs and alcohol, stress buildup, genetics, stress due to illness, personality types, and eating disorders.
The major types of anxiety disorders are obsessive-compulsive disorder, social phobia or social anxiety, panic disorder, and generalized anxiety disorder. The first of the anxiety disorders is obsessive-compulsive disorder. These are the different signs and symptoms, which include different compulsions and obsessions, or both, a person might have. This is the DSM-5 criteria for a person with OCD. The treatments include therapies and different medications which are used for all anxiety disorders.
The next anxiety disorder we have is generalized anxiety disorder. And we've added a picture to show some of the signs and symptoms for this. There are certain criteria that people need to fall under for the generalized anxiety disorder diagnosis, and these are some of them. Treatment for generalized anxiety includes therapies and medications along with the rest of the anxiety disorders.
Our next disorder is panic disorder. The signs and symptoms are seen here. This is the DSM-5 criteria for panic disorders. The treatment is also the same as the others, which includes psychotherapy and different medications.
Another form of anxiety is social anxiety, which includes social phobia. So we've added a picture of how someone might feel out in public. Signs and symptoms of social phobia include all of the following, but mainly it's the fear of being judged and being worried or embarrassed of oneself. We have the DSM-5 criteria for social anxiety disorder listed here. Treatment for social anxiety disorder, the first line is medications, and then there's also cognitive and behavioral and psychotherapy.
These are the general treatments for anxiety disorders, which include all the non-pharmacal interventions, also including cognitive behavioral therapy, which is the highest success rate with medications, including anxiolytics, antidepressants, anticonvulsants, and atypical antipsychotics.
We've added a chart with a list of medications that are used for each anxiety disorder, and they include the following.
Related nursing diagnoses include anxiety, powerlessness, social isolation, ineffective coping, ineffective role performance, disturbed body image, ineffective impulse control.
There are many nursing interventions for any type of anxiety disorder, including establishing a good rapport with patients, use simple and brief sentences to communicate, provide patient with a calm, low stimuli environment, administer patient medications as ordered, and PRN with increased anxiety, establish a safe environment when anxiety levels are high, maintain an area with minimal stimuli to prevent anxiety, provide reassurance about disease and treatment to patients, educate patients on new medication regimens and medication side effects, and encourage patient to participate in relaxation techniques, guided imagery, deep breathing exercise, meditation, yoga, and other things to reduce symptoms of anxiety.
And to conclude our concept map, we have some facts. There are 5 major types of anxiety disorders. 40 million people in the world have anxiety. Women are more afflicted to anxiety than men. Anxiety disorders are the most common mental illness in the U.S. A recent study showed that 59% of people with PTSD met the criteria for another anxiety diagnosis, and 97 individuals with panic attacks, out of 39% of them had abused at least one substance.
We hope you enjoyed our concept map on anxiety disorders.